What should you do if someone you know suddenly has a seizure? Well, Dr. Heide is a neurologist and director of telemedicine and stroke services at St. Mary's, and he is my guest tonight in Ask the Doctor. Thanks so much for being with us.
Thank you for inviting me.
Yeah, you bet. Okay, first off, what causes seizures?
Well, that's a good question. A lot of things cause seizures.
Okay.
Medications, lifestyle, and in fact, the epidemiological evidence shows that it's very high prevalence. We're talking about 10% of the population, 1 in 10 people will have a seizure sometime in their lifetime.
Who just unexpectedly
unexpectedly
for no other
have
reason?
a seizure, right? So you can imagine how many causes could there be for that large a population.
Exactly.
Almost anything. And I think if you put people in the right circumstances, anyone could potentially have a seizure.
So what do you do if suddenly you're with someone and they drop on the floor? I mean, do you just step back? Do you try and stop them from seizing? What do you do?
That's a good question. Number one, don't freak out. I know it's easier said than done,
Yes,
but don't freak out. Because
Okay.
I've seen it in my own family members. So even me, who treats seizures on a regular basis, has seen it in my own family members. It's hard not to freak out.
Sure.
When you see someone seizing in front of you, shaking and doing all these kind of things. Number one, keep them safe.
Okay.
So, you know, people feel like they have to do something. You don't have to do something other than just make sure they're in a safe environment. Make sure they're not going to hit their head or fall off something and things like that. You don't put things in their mouth.
Okay, makes sense.
And it sounds hard because you can imagine a person bites down, they're having a seizure, they bite their tongue, they're bleeding, they're incontinent. I mean, it looks like a messy situation. Let them be.
How long do they typically last?
Most last about 60 seconds and then they resolve, and people are usually very tired afterwards, and you can hear some snoring, they'll fall asleep. So it looks very scary, but in fact, they're usually pretty safe as long as they're in a safe environment.
And then quickly, we have 0 time left. Do you go straight to the hospital or not worry about it?
Yes, you absolutely do. You want to
Okay.
get medical attention. There's so many dangerous reasons for having a seizure. You want medical attention right away.
Okay, Dr. Heide, we certainly appreciate your time. I'm sorry our time is up, but he will be here until 6 o'clock tonight, still taking your questions. All you have to do is speak with him. It's out 858-2222.